So good morning everyone. This is Dr. Vineet Sehgal and welcome to this early morning session of Ocular Pharmacology. So this would be a rapid fire session where I have designed the most important questions that can be asked in the NEET PG exam from the various contents of the various drugs that we use in our ophthalmology. So hope you would like the session. A small introduction. I am your ophthalmology educator and you can see my videos on the Unacademy learning app. You can download it from the iOS store and the Play Store, where you can basically, if you go for the plus subscription, you can basically enroll for any of the plus batch which is going on. We have a lot of top educators all over the country teaching you day in day and night towards making your goal possible, and there are a lot of batches which are also coming from the systemic wise clinical rapid revision to the target next batch to the focus batch and to the operation batch course for the INICT exam. Okay, so with this we have a lot of things which are for there for the new users, for the users who are not the subscribers ones but who are just basically using the platform to basically enrich their knowledge. We have the T20 test, we have the FMG daily tests, and we have few more of the important information which is there for you in all of the scenarios. So with this, I would be coming to my session today, that is on ocular pharmacology. Okay, so what we would do is I would put a question and you would try to answer it in the comment section as soon as possible. Okay, so my first question today is shake and use. This is the usual methodology in which of the eye drop installation? Try to answer. So remember, shake and use, this is the usual methodology that we use in the netamycin. So netamycin has some residues. So when you have a bottle, this netamycin residues basically go down and settle in the bottom. Okay. So whenever you are using netamycin for a fungal ulcer, you just shake the bottle and then use it. Okay. Okay. So the next question is a question which was asked in the INICT exam. So patient presented with the eye ointment and eye drops. So both are basically given to the patient. Let's say the patient is having a dry eye. So what should be your order? Ointment first followed by the eye drops first followed by the eye ointment simultaneously, or anyone can be put at any time. Just try to answer. So the answer here is that eye drops has to be put first followed by the eye ointment. The reason is that whenever you have the putting the eye ointment, so this would basically cover the cornea. Okay, so this is your cornea. So if you put an eye ointment, it would cover your cornea and your ocular surface, which would basically decrease the penetration of the eye drops. Okay, so that's why we put an eye ointment. After that, basically uh, we put an eye drops. After that we can put an eye ointment when the penetration of eye drop is already done. Okay. Okay, let's move to our next question. Okay, so a patient presented with the hypoglycemia post putting a medication which is for raised intraocular pressure. So what is your drug which can be responsible for this? Your options are PG analogs, carbonic anhydrase inhibitors, beta blockers, or alpha agonists. Try to answer. So we have a hypoglycemia and raised IOP for which we are using the medication. So the answer here would be C, that is beta blockers. Okay. So remember, beta blockers like timolol can basically be used for the glaucoma, but they have some undesirable side effects. One is a hypoglycemia and other is they can increase the chances of exacerbation of COPD as well. Okay, so there are lots of side effects, but these two are the most commonly asked in the exam. Okay, let's move to our next question. Which of the following is most commonly used preservative in anti-glaucoma medication? Your options are carboxymethylcellulose, benzalkylonium chloride, N-acetylcysteine, or sodium hyaluronate. Most commonly used preservative in anti-glaucoma medications. So the answer here is benzalkylonium chloride. Okay, so this not only is basically used as a preservative, another side effect which is so commonly asked about this drug is that it can basically cause damage to your ocular surface as well. Okay, so these are two very important characteristics of the back. One thing that you have to remember regarding the back is that back not only is used as a preservative, it increases the penetration of anti-glaucoma medication as well. So it is something which we have to use, we do not have any choice, but the problem is that it can damage your ocular surface also. Okay, so next question is also a previous year question. Varsha, heterochromia iridis is a side effect of which of the following drug? Your options are PG analogs, brimonidine, dorzolamide, or timolol. Try to answer. Heterochromia iridis. Okay, what I mean is that the color of the two iris is changed. You can see it in some systemic diseases like Fuchs heterochromic iridocyclitis, and even you can see it in Horner syndrome also. Okay, so if they ask about the drug which causes the heterochromia iridis is our PG analogs like your bimetoprost, letoprost, or travoprost. Okay, so the answer here is A. Okay, so our next question is which of the following has to be stored at 4 degrees Celsius temperature? Okay, so you have to basically put the drug in the fridge. Usually whenever we have an eye drop, we tell the patient, let's say this is a eye drop. Okay, so uh, always in the eye drop in this area where the instructions have been written, it is always written that you should basically store it below 25 to 30 degrees Celsius and protect it from light and moisture. But one drug which you have to put it in the cold chain, the answer there is A, that is PG analogs, because they are not stable at the room temperature. Also remember, if you have anti-VEGFs, these anti-VEGF injections like ranibizumab, bevacizumab, they also has to be stored in a fridge at a temperature which is less than 4 degrees Celsius. Okay, so next question is another question regarding uh, anti-glaucoma medication, that is which of the following is contraindicated in children less than 8 years of age. So 8 साल से कम के बच्चे को कौन सी एंटी ग्लूकोमा मेडिकेशन, वैसे तो कोई भी नहीं देनी चाहिए, बट कौन सी बिल्कुल नहीं देनी चाहिए, इट्स कॉन्ट्राइंडिकेटेड. Less than 8 years of age. I give you a hint that this may cause CNS depression. So very good check. The answer here is B, that is brimonidine. So brimonidine should not be given because it can cause a CNS depression. So we avoid it in less than 8 years of age. Also, they can put a question like this, that after giving eye drop, the patient says that, sir, I am having too much dizziness and I feel that I cannot concentrate on the surroundings and I cannot concentrate on my work. So even if he is a individual of 35, 40 or 60 years, even then your answer would be brimonidine. Okay, let's move to our next question. Which of the following has been extensively studied as a drug that increases the ocular blood flow? So ocular blood flow is a new concept where the they have seen that the glaucoma occurs due to the decrease in the ocular blood flow. So we may have some medicines which are acting not only at the level of the outflow, they are also acting posteriorly, that increases the total blood flow to the optic nerve head, let's say through the posterior ciliary arteries which are supplying the blood supply to the optic nerve head. So what is your answer here? So the answer here is C, that is dorzolamide. So the carbonic anhydrase inhibitors, and in that also most commonly the dorzolamide has been studied that it can increase the ocular blood flow. And one drug which decreases the ocular blood flow is a timolol. Okay, so any patient who is having a normal tension glaucoma or who is having a vasculitis, we avoid giving a beta blocker. Okay, we avoid giving a beta blocker because there can be the problem because of your decreased blood flow, and if we give timolol that may basically worsen the situation. Okay, let's move to our next question. Teprotumumab is a drug which we use for which of the following? Your options is optic neuritis, pseudotumor, thyroid ophthalmopathy, or Muran's ulcer. Try to answer. So the answer again here is C, that is thyroid ophthalmopathy. How you can remember it? So TE, you can just remember it with thyroid eye disease. Also, you have pro. So pro is proptosis. So you know the most common cause of bilateral or unilateral proptosis in adults is your thyroid eye disease. So this is a trick through which you can just remember what is the answer here. Okay, Shobha, let's move to our next question. A patient presented with hypoglycemia post putting medication for raised intraocular pressure. He may be instilling which of the following? Your options are PG analogs, carbonic anhydrase inhibitors, beta blockers, or alpha agonists. Try to answer. So I think this question has been repeated, and anti-glaucoma medication which can cause hypoglycemia, it is your C, that is beta blocker. Okay, so with the PG analogs I told you they have an important side effect which is basically change in the color of iris, so I call it heterochromia iridis. Alpha agonist is more commonly associated with blepharoconjunctivitis, and carbonic anhydrase inhibitors, they can cause the dry eyes and stinging sensation. Okay, I'm talking about the topical medications. Okay, let's move to the next question. So the drug of choice for open angle glaucoma is timolol, bimatoprost, dorzolamide, or brimonidine. Drug of choice for open angle glaucoma. So whenever they ask about the open angle glaucoma, the answer here is your PG analogs. Why the PG analogs are the drug of choice? Because they have the advantage of OD dosing. Okay, they are free from systemic side effects, and nonetheless they have the maximum decrease in the intraocular pressure by around 25 to 30%. Okay, so these all reasons would make my PG analogs one of the drug of choice for the open angle glaucoma. Okay, okay. So the next question is, which of the following is the new drug that has been used experimentally in the cases of amblyopia in the children for BD dose? BD dose means twice a day dose. amblyopia. So remember, whenever they talk about the amblyopia, the drug which have been used again and again is the drug which is citicoline. So citicoline has been seen that if you give it for 3 months in children for BD dosage, it has decreased the, with addition to your patching, it has decreased the amount of amblyopia in the children. Remember, bilberry extracts and rho kinase inhibitors, they have been used in the glaucoma, and coenzyme Q has been seen to have good effects in the patients who have macular disorders. Okay, so the answer here is D. Okay, let's move to the next question. Brocluzumab is a new drug that has been used in which of the following? Posterior uveitis, wet ARMD, dry ARMD, or central serous retinopathy? Brocluzumab. So remember, brocluzumab is a drug which has been used in the wet ARMD. Like your ranibizumab and bevacizumab, the problem with these drugs are that they have to be given every month for few months. Okay, so 3 months we tell the loading dose of your ranibizumab or bevacizumab that has to be given, and even then they have to be repeated again and again. The advantage with the brocluzumab is that what we have seen is that the amount of injections or the number of injections that you have to give in the patient who is suffering from wet AMD, if you put the brocluzumab, is much less as compared to your ranibizumab and the bevacizumab. Okay, so remember this new drug, that is the brocluzumab. Okay, so next question is drug of choice for angle closure glaucoma. Your options are timolol, bimatoprost, dorzolamide, brimonidine, and pilocarpine. Now, do not basically get confused. Whenever they ask about the angle closure glaucoma, so the first option that you would do is definitely not the drug, but you would go for a procedure. Okay, so the procedure like your YAG iridotomy, that is the first procedure that you do. But unfortunately, if you get this question, then you have to basically go with the drug. The only drug which is the FDA approved for the angle closure glaucoma is your pilocarpine, because pilocarpine acts on the angles to open them. Okay, so pathogenically only this drug is basically acting on the angles and basically causing the contraction of your muscles so that they basically cause the opening of the angle. Okay, so the answer here is E, that is pilocarpine, not timolol. Okay. Okay. So next question is drug of choice for anterior uveitis. Your options are pilocarpine, steroids, atropine, or mannitol. So whenever they talk about the anterior uveitis, the drug of choice is always a steroids. Okay, so the topical steroids. Now do not confuse with, sometimes students ask me, sir, why it is not a atropine. So atropine is not there. The reason is that atropine is basically a adjunct. Okay, so like in dinner you are having a rice and dal, and then you are having a ice cream also. So ice cream is not your main thing. Ice cream is like a dessert, a side thing. So similarly, atropine or homatropine or any cycloplegic, that basically causes the relief to the patient, decreases the complication, but it is not usually acting on the pathogenesis. So drug of choice, remember, whenever they ask a drug of choice, it should be a drug which is basically acting on your pathogenesis. Like in malaria, your drug of choice is not your this one, not your paracetamol, it is your quinine. Okay, so similarly, drug of choice for anterior uveitis is not atropine but steroids, or any type of uveitis, whether it is a anterior, intermediate, or posterior uveitis, you answer it as a steroid. Pilocarpine, avoid in the patients of uveitis because they can cause the contraction of iris and increase the pain and increase the symptoms of the patient. Okay, welcome Dr. Ju. Okay, so next question is prostamide used as an anti-glaucoma medication is tefluprost, brinzolamide, bimatoprost, or acetazolamide. Try to answer. So prostamide, which is a type of PG analogs, the one which is most potent of all the PG analogs, that is your C, that is bimatoprost. Remember, bimatoprost, which comes in the PG analog, is one of the most potent type of PG analog. And also remember, it is the problem with the bimatoprost is it causes maximum amount of redness of the eye, which I call hyperemia. Okay, so the answer here is C. Okay, let's move to our next question. Bilateral angle closure and myopic shift. So bilateral angle closure and myopic shift is the side effect of which of the following drug? Your options are pilocarpine, acetazolamide, atropine, or topiramate. So try to answer, everyone. So bilateral angle closure, why it occurs? Because of the phenomena of the choroidal effusion. Okay, similarly, what it causes is it causes the myopic shift also. Okay, so your eyeball tends to go further away, and that's why you feel that the patient is having a myopic shift. So the answer here is D, that is topiramate. Okay, so topiramate is, yes, acetazolamide can be rarely in the answer, but whenever you are getting a MCQ, you should answer the most probable cause. Okay, so most probable cause here is, that is D, that is topiramate. Okay. Okay, so let's move to our next question. A patient presented with the, so I think we have done with this. Okay, so the next question is, blepharoconjunctivitis is most common complication of which of the following anti-glaucoma drug? So I have basically explained this question. Try to answer it as fast as possible. Blepharoconjunctivitis. Though it can be a side effect of any anti-glaucoma medication, but the one which is most commonly implicated is your alpha agonist, that is your brimonidine. Okay, let's move to the next question. Okay, this has been done. Okay, so the next question is, which of the following drug is used as a drug of choice in vernal keratoconjunctivitis? Your options are steroids, atropine, olopatadine, or pilocarpine. Vernal keratoconjunctivitis. I told you about a very important mnemonic, a very funny mnemonic, first prof bursa. So it is a type 1 hypersensitivity reaction which is there in the first decade of life in the boys, and there is a bilateral conjunctivitis, bilateral papillary conjunctivitis there with that thing, that conjunctivitis which is increasing on your summer days. So remember, the one that I use is the mast cell inhibitors plus the antihistaminics. And the answer, the most probable and the best answer here is C, that is olopatadine. Yes, I can use steroids in some cases like your soft steroids, loteprednol, fluorometholone, but when you have to use it in the vernal keratoconjunctivitis, you have to give it for long time. And that can basically cause the increase in intraocular pressure and cause glaucoma. So I do not use steroids unless otherwise too much necessary. Olopatadine and the new drugs like L-caftadine and bipotestine, they are new drugs which are very much effective in the patients who are suffering from vernal keratoconjunctivitis. Okay, so our next question is, drugs that can cause iris cyst. They are dorzolamide, moxifloxacin, ecothiopate, or loteprednol. Iris cysts sometimes can be seen in the patients who are using cholinergics like ecothiophates. Okay, so remember, iris cysts can be seen in ecothyophyte. Also, it can be seen in the patients who are using pilocarpine, and very rarely it can be seen even in the patients who are using PG analogs. Okay, in all of these you can have a iris cyst. So the answer here is C. Okay, so our next question is, topical cyclosporine is used in which of the following? Glaucoma, ocular surface squamous neoplasia, conjunctivitis, or dry eye? Topical cyclosporine eye drops I use twice a day, and also has to be used months together. Let's say 3 months. I use it. Very good, Dr. Shaurya. I use it in the patients who are suffering from dry eyes. So remember, a drug which is used in ocular squamous surface squamous neoplasia topically is topical mitomycin C. Okay, so it is B, that is topical mitomycin C. Okay, so our next question is that we already told you that the PG analogs can, sorry, the benzalkylonium chloride can have the problems on the ocular surface. So we have developed a preservative-free PG analog. So the preservative-free PG analog in this condition is bimetoprost, travoprost, uniproston, or tefluprost. So the answer here is D, that is tefluprost. So preservative-free PG analog which has been developed is tefluprost. Okay. So with this question we end our session, that is, sodium ascorbate is used in which of the following? Your options are dry eye, glaucoma, conjunctivitis, or alkali injury. So friends, I have taken a YouTube session on the Unacademy. Unacademy that is just about the chemical injury. So chemical injury and the emergency medicine have been asked again and again in your exam. So if you have any doubts, if you want notes, you can just go into the chemical injury Unacademy, Dr. Vineet Sehgal, you would get the lecture on that. Okay, and if you have any doubt, you can go to our channel, that is the Let's Crack NEET PG Telegram channel, and you can ask for the any doubts there also. Okay, so the answer here is D, that is alkali injury. So that is sodium ascorbate is usually seen in the alkali injury. So two very important points that you have to see in a patient who is suffering from the alkali injury, that if you can see there is a blanching of the conjunctiva and few hemorrhages also. Also you have a total corneal edema, patient may be suffering from the dry eyes also. Okay, so these are very important signs of the chemical injury, where what is your treatment? You use topical steroids, you use topical antibiotics, you use sodium citrate which inhibits the neutrophils degranulation, and you can use sodium ascorbate. Why you use sodium ascorbate? Because it promotes the collagen synthesis. You can also go with the artificial tears like autologous serum, umbilical cord serum, which promotes the reepithelialization. Use topical cycloplegics if there is a iritis. Use anti-glaucoma medications if there is an increased IOP, and you can basically also use doxycycline which inhibits the MMP. So these are the treatment modalities which are we using in the patients who are suffering from chemical injury. You can see the detail of chemical injury in our YouTube session. So with this I end my session and would be just telling you about the various ways to get the Unacademy subscription. You can go with the plus subscription or the iconic subscription, where you would have the advantage of prep ladder as well, and you can use our code, that is Ophthal10, to get 10% discount on whatever things that you want. And basically subscribe for our channel, that is the Let's Crack NEET PG. Subscribe for it and please hit the button like and share. Thank you very much.